Welcome to our deep dive into pedicle autografts, a cornerstone in periodontal plastic surgery. Today, we'll explore the various flap techniques used to treat gingival recession, focusing on their history, indications, and step-by-step procedures. Whether you're a dental professional or a curious learner, understanding these methods will enhance your knowledge of gum grafting and its clinical applications. Let's begin by setting the stage with what pedicle autografts are and why they matter in modern dentistry. The laterally displaced flap, also known as the sliding flap operation, was developed by Group and Warren in 1956. This innovative approach marked a significant advancement in periodontal surgery, allowing clinicians to cover isolated, denuded roots using adjacent tissue. The technique's primary goal is to restore both function and aesthetics by repositioning healthy gum tissue over areas of recession. Understanding its origins helps appreciate the evolution of periodontal procedures and the rationale behind using pedicle flaps for root coverage. One of the main advantages of the laterally displaced flap is that it involves only a single surgical site, making the procedure less invasive for patients. The pedicle flap maintains excellent vascularity, which is crucial for healing and graft survival. This technique is especially effective for covering isolated, denuded roots when there is adequate donor tissue available laterally. These benefits make it a preferred choice in suitable clinical scenarios, offering predictable outcomes and improved patient comfort. Despite its advantages, the laterally displaced flap has several limitations. The procedure is restricted by the amount of adjacent keratinized attached gingiva, which can limit its applicability. There is also a potential for recession at the donor site, and risks such as dehiscence or fenestration may occur. Additionally, this technique is generally limited to treating only one or two teeth with gingival recession, making it less suitable for more extensive cases. The laterally displaced flap is indicated for covering isolated denuded roots, particularly when there is sufficient width of interdental papilla in adjacent teeth and adequate vestibular depth. These anatomical prerequisites ensure that the flap can be mobilized and positioned effectively over the defect, maximizing the chances of successful root coverage and tissue integration. However, not every case is suitable for this technique. Contraindications include deep interproximal pockets, excessive root prominence, deep or extensive root abrasion or erosion, and significant loss of interproximal bone height. These factors can compromise the stability and success of the flap, so careful patient selection is essential for optimal outcomes. The procedure for the laterally displaced flap begins with resecting the gingival margin and performing root planning to prepare the recipient site. The flap is then reflected, either as a partial or full thickness, and carefully slid laterally to cover the defect. Once in position, the flap is secured with interrupted sutures and protected with a periodontal pack to facilitate healing. Each step is designed to ensure optimal adaptation and vascularity of the grafted tissue. The double papilla flap, refined by Cohen and Ross, is another innovative technique in periodontal surgery. This method utilizes the papillae adjacent to the defect, allowing for effective root coverage when the laterally displaced flap is not feasible. The double papilla approach is especially useful in cases where the defect is too wide for a single papilla to cover, ensuring better adaptation and healing. The double papilla flap offers several advantages. It minimizes the risk of alveolar bone loss, which is a critical consideration in periodontal therapy. The papillae provide a greater width of attached gingiva compared to the radicular surface, enhancing the stability and integration of the graft. Additionally, this technique has fairly good clinical predictability, making it a reliable option for suitable cases. The coronally repositioned flap is primarily indicated for aesthetic coverage of exposed roots and for treating tooth sensitivity. This technique allows for the treatment of multiple areas of root exposure without involving adjacent teeth. Its high degree of success and versatility make it a popular choice for both patients and clinicians seeking effective and aesthetic outcomes. The Semilunar Flap is a specialized technique designed for areas where gingival recession is limited to 2-3 mm. This minimally invasive approach is ideal for small, localized defects and is valued for its simplicity and effectiveness. The semilunar incision allows for gentle repositioning of the tissue without extensive surgical manipulation. The semilunar flap offers several unique advantages. It does not cause vestibular shortening, preserving the depth and function of the vestibule. There is no aesthetic compromise of the interproximal papillae, maintaining the natural appearance of the gum line. Additionally, this technique generally does not require sutures, further simplifying the procedure and enhancing patient comfort. Each flap technique has its own set of indications, advantages, and limitations. The laterally displaced flap is best for isolated defects with adequate donor tissue, while the double papilla flap is ideal for wider defects. The coronally repositioned flap excels in treating multiple exposures, and the semilunar flap is perfect for small, localized recessions. Understanding these differences helps clinicians select the most appropriate technique for each patient. Pedicle flap surgery relies on principles such as maintaining vascularity, ensuring adequate tissue thickness, and minimizing trauma to both donor and recipient sites. Success depends on careful patient selection, precise surgical technique, and thorough postoperative care. These foundational concepts are critical for achieving predictable and aesthetic outcomes in periodontal plastic surgery. In summary, pedicle autograft techniques offer versatile solutions for managing gingival recession. By understanding the indications, advantages, and limitations of each flap, clinicians can provide tailored care that maximizes both function and aesthetics. Remember, the key to success lies in meticulous planning, patient selection, and surgical execution. Thank you for joining us on this journey through the art and science of pedicle flap surgery.